Hey, y'all, what's going on? Sydney, back with part 3 of my Living with Sickle Cell videos. I just want to thank you guys for the support. I want to thank you guys for sharing the videos so much. I've been getting contacted and emails from people I had no idea would even watch these videos or even, come in contact with them or enjoy them. So I just want to appreciate that, and my family's been supporting me and everything, and just sharing the videos and just basically getting the knowledge out there and letting people know that this is serious, and I'm gonna try to put this disease on the map however I can, and make sure people don't have to suffer from it, or put enough knowledge out there so that people can understand it more. I just wanted to share this story with you guys. I was in the emergency room about a day or two ago, and I was having a pain crisis, sickle cell crisis. Now, basically, a crisis is when we experience extreme pain, and this can happen anywhere in our body. Now, usually your red blood cells are shaped like a disc, but being that our red blood cells don't get enough oxygen to them, they end up turning into a crescent shape, and they create this clutter in our blood vessels. And this is why we get the extreme pain. This is why we get the crisis. This is why we, have to go to the hospital so often. And anything can set it off. A lot of activity, cold weather. Sometimes it's just spontaneous. Sometimes it's because you're dehydrated. A lot of things can set it off. And us as sickle cell patients, we have frequent visits to the hospital. So, that's nothing out of the ordinary. Now, what I want to speak about is the medication that they give us in the hospital. They give us strong medication like morphine, Demerol, Dilaudid. These medications are narcotics. These things you can get addicted to in the snap of a finger. You can abuse them, and I'm pretty sure that a lot of people do use them in the wrong way, which kind of puts the sickle cell patients in a negative light because of that. But I feel like we shouldn't suffer because somebody's using these pain medications the wrong way. We shouldn't get the short end of the stick. And I say that because when I was in the emergency room a few days ago, the doctors, they gave me less medicine than what I usually get. I have a certain regimen. I have a chart. And every time I go in there, you can look up Sydney. My chart is as thick as the Bible. I've been in the hospital my whole life, You can look and you can see what kind of medications I take. Now, being that I've been there so frequently over the last few months, the doctor on call, he didn't believe that I was in that much pain. He probably figured out that, I'm coming to abuse the medication or just getting high. Now, this doesn't only happen to me. I have several friends in the hospital that have sickle cell that go to the hospital, and they say that the doctors treat them the same way, and they look at them in the same light, and that's not right, That's not fair, because we're not drug addicts, and we're not addicted to this medication. I wish I can go to the corner store and tell the man behind the counter, yeah, let me get this, and I feel better. You know what I'm saying? I don't want to take strong medication all my life. I don't want my heart to stop. I don't want to. Anything can happen. These medications are. People go on the street and they sell these drugs. These are drugs that people get high off of. So this is very strong. This is a very serious matter, and I'm voicing my opinion because nobody should have to be in excruciating pain laying on a hospital mattress, and their physician or their doctor or their nurse is denying them their right regimen of pain medicine. That just doesn't make any sense to me. So, I'm gonna leave out on that note. I want you guys just to spread the word, spread the video, because there's clearly not enough knowledge in these hospitals that these doctors can figure out that sickle cell patients are gonna be there a lot. and they're gonna need their right regimen of medication, regardless of how strong it is. You can't just ignore a patient because you feel like they're not using the medicine the right way. There's no way to measure pain. They ask us that silly question, what's your pain on a scale of 0 to 10? 0 to 10. You can't measure pain from 0 to 10. Like, you know what I'm saying? That's like you asking your mother, hey ma, how much do you love me on a scale of 0 to 10? There's no measures for that. It doesn't make sense. So, we could tell a doctor, oh yeah, my pain level's, a 7, and they're like, oh, well, since it's a 7, we'll just give you this for now. But everybody's pain tolerance is different, and everybody needs different medication. Nobody's the same patient. So I'm not trying to keep you guys long. I really don't want to be, venting but this, I had to get this off my chest because it really frustrated me, and it frustrated my mother and my father, and they was there with me that night, and we was all trying to figure out what's going on here. So if I can prevent this from happening to anybody else by sharing this video, and if any doctors can see this video, if anybody with a platform, a medical platform, can watch this video and share it and see that I'm a sickle cell patient, and on behalf of us, I'm speaking out and saying that somebody needs to do something about this and make sure that we get our right regimen of pain medication, so we're not laying on that mattress in tears, feeling horrible because you don't want to give us the right regimen because you feel some type of way. That's my main concern right now. So like I said, I just want to thank you guys for watching the video again, watching the videos and everything. The support's been amazing. It's really been crazy. I actually have an idea in my head, and to make these videos even better. And in the upcoming installments, I hope that I am able to make that happen for you guys. And, so it's not only me speaking, it's other people speaking, speaking out and everything like that. So, like I said, thanks again. Please don't feel bad for me. No pity, no sympathy. You know what I'm saying? This is all God's grace. You know what I'm saying? I'm here in front of you. I'm speaking. I'm alive. I'm feeling good. I'm healthy. So, no need to feel bad. Just help me spread the word so that future generations, they don't have to experience this.